Hello and welcome to Blackwatch International. My name is Mintberry Buddha, and in this training video we will be looking at the medical system from a corpsman's perspective. The corpsman is among the most essential roles in our organisation, and the platoon will never deploy without one. They are responsible for triaging and treating all wounded personnel, managing the medical station, keeping inventory of medical supplies, and performing medevacs. Blackwatch International uses the ACE Advanced Medical System. This system adds an in-depth medical simulation, complete with localized injury, separate wound treatment, vital simulation, and more advanced medical equipment and procedures. In the next couple of minutes, we will talk about the correct procedures a corpsman needs to follow to make sure all the wounded get treated efficiently, and what equipment they have at their disposal in order to do so. The corpsman has access to a unique loadout that gives them all the necessary equipment they need to fulfill their duty. They have access to a larger supply of bandages of all types, as well as tourniquets, several morphine, epinephrine, and adenosine injectors, several plasma and saline IV bags, and most importantly, a surgical kit. Often the corpsman will also get a box of medical supplies. These contain additional bandages, IVs, and medication. Be sure to keep an eye on your reserve of medical supplies, as you won't always get a large or infinite supply. When low on supplies, the corpsman will have to ration IVs and medication and recover supplies from the battlefield. The medical station is the main base of operation for the corpsman. This is where all injured personnel will be treated. There are three types of medical stations. A designated medical vehicle. No matter whether the vehicle is parked or on the move, the corpsman is able to perform surgery on anyone inside, no matter their position inside the vehicle. It is advised that the corpsman uses the ACE medical menu when inside a vehicle, as the basic ACE interaction menu can get quite long. A medical tent. The tent needs to be assembled before it can be used and disassembled when the medic needs to displace. The corpsman can stitch casualties within the confines of the tent. It is advised that all wounded lie down on the floor, that way interaction with the patient is done more easily. A medical mat. Special Forces corpsmen get access to a unique type of medical station. They can set up a medical mat in any type of building. A small radius around the mat will then be designated as a medical zone, where stitching can be done. Once again, we advise that all the patients lie down so the corpsman can interact more easily. When wounded enter the medical station, be sure to quickly check each patient's vitals. It is advised that vitals are checked on the head, as they may have tourniquets on limbs, preventing vitals from being checked. There are two vital signs you can read: heart rate or pulse and blood pressure. A good heart rate is between 70 to 90, and a good blood pressure is between 100/60 and 120/80. These vitals represent a patient's cardiac output, how much blood the body can circulate in a given amount of time. After reading their vitals, the corpsman can then use the triage cards mentioned in our previous video to help categorize the type of injured. It is also possible to attach triage cards to patients. That way, other teammates can immediately see what type of injured they're dealing with. To set a triage card, use ACE Interact on the patient's torso and select the triage card option. There you can click on the bottom of the card to set the type of injuries. Once again, the most severe cases take precedence over those with minor injuries. Now that the corpsman has triaged everyone in the medical station, they can start treating patients according to triage protocol. The most important step is to stabilize the patient. If the patient is still bleeding profusely or has a very low BP, the corpsman should immediately apply an IV to buy them some extra time in stabilizing the patient. Once the patient has been bandaged and no longer has any bleeding wounds, they can perform surgery using the surgical kit. To do this, select the Use Surgical Kit on the torso in the ACE Interaction menu, or under the Advanced Treatment tab in the ACE Medical menu. Depending on the amount and type of injuries, the duration of stitching can vary. When stitching is done, be sure to remove all applied tourniquets. The corpsman can ask the patient to remove the tourniquets themselves so they can go back to treating other patients. However, corpsmen should always verify themselves that tourniquets have been removed before they release the patient. Now that the patient no longer has any wounds, the corpsman will need to decide whether the patient needs IVs or medication. First, we'll have a look at IV bags. IV bags are used to increase a patient's blood pressure, as they will replenish the blood supply inside the patient's body. There are 3 types of IV bags, but they all serve the same purpose. They come in 3 different sizes. 250ml takes about 60 seconds to complete. 500ml takes about 2 minutes to complete. 1000ml takes about 4 minutes to complete. Note that the blood pressure will always slowly increase on its own. IV bags are not needed when you're just short of normal ranges. Please note that the lost a lot of blood text on the ACE medical menu is not a good indication of a patient's blood pressure. Next, we will have a look at the different types of medication. There are 4 types of medication the corpsman has at their disposal. Medication can only be applied to arms and legs, and you need to make sure a tourniquet isn't blocking the medication from entering the body. Morphine. Morphine is used to reduce a patient's pain and lowers the heart rate and blood pressure. Morphine will also permanently and irreversibly reduce a patient's blood viscosity, hampering cardiac output and making future medical treatment less effective. A patient should therefore never be given more than 1 morphine, and should never receive one without first having their vitals checked. Giving morphine to someone with a low pulse will be fatal. Epinephrine. Epinephrine is medication that will increase a patient's heart rate and blood pressure. It should never be given if the patient already has a high pulse or blood pressure, as this can have fatal consequences. Hence, you should always check the patient's vitals before administering epinephrine. Adenosine and Atropine. As currently implemented, these medications will lower the heart rate and blood pressure. The difference with morphine is twofold. Firstly, they don't affect the patient's blood viscosity and are therefore a safer choice for reducing a high heart rate. Secondly, they don't reduce pain. Please remember that a casualty's cardiac output will vary according to their condition, impacting the effect of medication. Patients receiving an IV or patients with particularly low vitals may be less responsive to medication, while patients with high vitals may be more responsive. The effect of medication generally lasts between 30 to 60 seconds. As a casualty's exact condition can be unpredictable, close monitoring during this period is necessary to make sure the patient does not rapidly deteriorate. Check vitals every 10 to 15 seconds after administering medication until the vitals stabilize. Corpsmen should never send out patients that are receiving IVs or have just received medication. The only time they can do this is when the IV is almost done and the patients are already showing healthy vitals. Between vital checks, the corpsman is free to treat other injured inside the medical station. They should never focus all their attention on one patient, but try to treat different patients at the same time. Now you have a good basic understanding of the responsibilities of the corpsman and what their role is in our operations. Thank you for watching this video on medical systems. If this video is useful, be sure to give it a like. Subscribe for more Army 3 content and check out our website for more information on Blackwatch International.